We've got Anne from the Royal London Hospital. Hello, Anne, welcome.
And we have Paula from South Yorkshire. Welcome, Paula. Sharon from Stockport, welcome. Lorraine from Liverpool, welcome.
They're all flying in now, aren't they, Elizabeth? So we've got Sophie. Hi, Sophie Ford from a cloudy Lincolnshire. We've got Joe. Hello, Joe from the Royal Bournemouth Hospital. A special hello to Sonia, who will be sharing with us some of the national work that's been going on to support the well-being of our health and care staff. Hi, Sonia, and thanks for sharing your Twitter handle there. Please do, if you are on Twitter, share your Twitter handles in the chat room so that we can start collecting a list and making sure that we're sharing all the relevant information with you on Twitter.
Hello, Lydia.
Hi, Lydia.
We've also got Rachel. Rachel is from Avon in Wiltshire. Welcome. And we've got Rosie from Cheshire. Welcome. Lots and lots of participants today. Welcome.
Got lots of Twitter handles coming in. Super. We are on Twitter today. Some of our colleagues, Lee and Zara, will be on Twitter today as well. And we'll be using two hashtags. The first hashtag is hashtag caring for, that's the number 4, NHS people. And we've got our NHS people as well. So if you are on Twitter, Lee and Zara will be quite active on there during the session as well, so that you can follow up on there and with the conversations after the session. So welcome, everybody. We do like to see faces on Twitter and also on the session here today. So there's a few functions at the bottom of the screen that you can use during this session. So if you just move your mouse, you'll see at the bottom of the screen, you'll find the mute button and mute. So we're going to be going into some breakout rooms today. So you'll be able to unmute and mute during that. There's the video, which is stop video and start video. So it's lovely to see faces if you want to switch your cameras on, and we've got the chat function there as well. So what we'd love everybody to do is keep chatting throughout the session, if you can multitask in the chat box. So I'm going to move us on to the next slide, which is all about where you are. So let me just see if I can move us on. Here we are. So where are you joining from today? Over to you, Paul. Let's do some annotation as well as the chat box still continuing.
Okay, thank you, Zoe, and welcome to everyone who's joined early. You'll find the annotation tools on the top of your screen next to the green bar saying you're viewing TED React screen. There's some view options. If you click on the view options, it gives you an option to annotate. If you click on that, it'll then pull up a bar which contains the various controls. And so if you could put an indicator on the map to show where you are. There we go. I can see a couple of people demonstrating that now. If anyone can't use the map for any reason, please put a note into the chat so we can pick it up from there. And if possible, could you draw where you are? Because the map will only allow a single arrow at a time. So whoever puts it on last is the only name showing.
That's brilliant. So we've got some people starting to put little dots on the map. We've got a few people in London. We've got someone in Liverpool. Often find this type of map helps me knowing a few little map landmarks on there. We've got Louise in London. We've got a few people also just joining the map there in the northeast. Paul, do you want to give us the instructions again of how do we find the annotation?
Of course, if you move your mouse to the top of the screen, you'll get a green bar saying you are viewing TED Re screen. Next to that, there'll be some view options. If you click on the view options, it'll give you a drop down, one of which will allow you to annotate. So if you click on annotate in that option list, it'll then open up a bar with some controls on it, and that will let you select a tool to mark on the map where you're from. We'd suggest that you click on the either draw or the stamp, because if you use an arrow, there's only a single arrow that can be on screen at a time. I can see a lot of people have found now the cross to indicate where they are.
Excellent. So we've got someone in Scotland, someone in Ireland, or just off in the sea in Ireland. Welcome. We've got a few more people in London, and a few more people sort of coming in the north there. Hello and welcome, everybody. We had quite a lot of people from Scotland last time. Not as many today, but there might be some more people on YouTube. So if you are on YouTube with us today, please do add into your chat box as it comes available. Hello, Sarah from Cardiff. Hello, Maria from Bournemouth. Hello and welcome, everybody.
We've got Fiona from Leeds. Welcome. Thank you. We've got Sarah from Cardiff. And Nick from London. Sarah from Brighton. Welcome to all of you. Rebecca from sunny Nottingham. It's also sunny down here in West London, so a good day, a good day.
Thanks, Paul. So I think we're just going to close the annotation now. So if you're just joining us, welcome. Welcome to this wellbeing session. And what we're just doing now is just finding the chat box, which is at the bottom of your screen, and it'll pop up on the right-hand side. And you will be able to chat throughout the session. Everybody is on mute at the moment, but we're going to have quite an interactive session where we will manually unmute everybody, and then you can use the mute and unmute buttons throughout the session. But at the moment, everybody is muted. So Paul, if you wouldn't mind closing the annotation and clearing the screen, that would be fantastic. Thank you. Hi, Brian from Scotland, and Linda from West London. We've got Lucy. Hi, Lucy, and Ed and Liz from Devon. They're all piling in now. Hello and welcome, everybody.
Yeah, we've got Rachel from Birmingham, Anne from Leeds, Karen from Bristol, Norma from Yorkshire. Welcome.
Well, thank you so much for joining us today. Hello, my name is Zoe Lord, and I'm delighted to be co-facilitating this session with you today. This is all about how do we develop a community to look after ourselves, look after our staff, look after our community, and look after our loved ones. So welcome to the second wellbeing session. These are weekly wellbeing sessions. And before we get started, I just wanted to again highlight some of the support offers that are available. We've got the telephone line, we've got the text support with a real person on the other side of the line, texting staff who need help. We've got free access to mental health apps, and we've got our website, people.nhs.uk, where we can find out more information about the national offer that's available. So welcome to this session. This is going to be quite an interactive session. If you joined last week, it's going to be a little bit different than last week. We're going to alternate these sessions. So one week we'll be on the platform WebEx and also on YouTube. And it'll be more of a conversation with some of our experts from our Wellbeing Task Force. And we'll alternate it with a session like today, which is all about connecting our community, building our relationships, learning and sharing from one another. So the aims of this session, we're going to offer some support, ideas, knowledge, wisdom for everybody who's got a role in supporting the health and well-being of people working in health and care. We're going to be sharing a wide range of support activities that are available, and also we're going to be building this community. Together, we're going to build this community where we can support each other through this period. So as I said, I'm going to co-lead you through this. My name is Zoe Lord, Deputy Director of the Horizons team, and I look forward to co-leading this session with Elizabeth. Elizabeth, do you want to introduce yourself?
Yeah, thank you. My name is Elizabeth Nyawade, and I'll be co-facilitating with Zoe. And today we have 3 presenters for the session. We've got Dr. Sonia Wellbeing, who is also our national lead for Wellbeing. And then we've got Professor Mike Holmes, who is a GP, but also on the task force for Wellbeing nationally. And then we've got Kim Nass, who will share with us views. Kim is an executive director at Southwest Ambulance Trust. And behind the scenes, we also have colleagues who are supporting us today. Our technical hosts are Paul, Selina, Tej, and Zara. And on the chat box facilitators, we have Roseanne, Louise, and Cheryl. And on the YouTube, we have Ollie and Helen. And on the social media, very, very important, we've got Lee, who will be tweeting throughout the session today. Thank you. So on our agenda today, me and Zoe will facilitate this session, and we will hear from Sonia about an update on our national support offer. We will also hear Professor Mike Holmes talk to us about managing stress, sharing views and ideas on that. And we will also hear from Kim Nass, who will share with us an organizational approach to supporting well-being. We will also have virtual breakout rooms for smaller conversations where we'd encourage all of you to share your ideas, and that's where we get a richness of our learning from. And we will end the session with a call to action and some closing remarks. Okay. Can I have the next slide, please?
Thank you. Thanks, Elizabeth. Hello, sorry about that. So we're going to go to 2 polls now. So I'm going to ask my colleague Paul to help us with this. So what we'd love to know and you to help us with is, how confident do you feel about managing your own stress levels during COVID-19? So we're going to put up the poll now. So number 1 is not very confident at all the way up to number 5, which is very confident. I can recognise symptoms, have a clear strategies to manage my own stress. Now, if you're in YouTube, welcome. Please do answer in your chat box. And if you're in Zoom with us, you should see a box that is popping up now. So if you can't see the poll, then please do add to the chat box as well. So how confident do you feel about managing your own stress levels during COVID-19? So when the results come up, we're going to, yes, I have the poll results. So we've got quite a majority on number 4. So people feeling quite confident about managing their own stress. We've got some people, about 17% on number 5, and we've just got a few people who are at the lower level of 1, 2, and 3 as well. So thank you ever so much for continuing and filling that poll in for us. So so I've just got one more poll with us. Sorry, I seem to be muting and unmuting. It seems to be automatic. So please do, Paul, tell me if I go on to mute and it's automatic. So this is our second poll. How confident, we've just had this one. Here we are, slides are moving on their own too. So how confident are you about your ability to support your colleagues through periods of stress during COVID-19? This is about your colleagues. So 1, not very confident, all the way up to number 5, very confident. So Paul, please could we launch that poll? And again, if you're in YouTube, please do use the chat box within YouTube. So how confident are you with your ability to support colleagues through periods of stress? So if you can't see the poll, please do add to the chat box within Zoom or within YouTube. Okay. So the polls are in, and again, the majority of people are either 3s or 4s. So we've got about 46% of people have scored 4 on this. So that's absolutely fantastic. So we'll use this information to start thinking about the offer going forward. What I'd like to do now is just introduce Sonia Wellbeing. Hi, Sonia. Would you like to give us a little bit of an update about the National Wellbeing Offer and introduce yourself as well?
Yes, hi everyone. So I'm Sonia Wellbeing. I'm a consultant psychologist by background, and I'm leading the health and wellbeing response for the NHS in England currently, with Em Wilkinson Bryce, who's the Deputy Chief People Officer, and Prana, who's our senior person leading that work. Can I have the next slide, Zoe? So we excitingly, amongst a fanfare, launched the health and wellbeing offer last week. So I just wanted to give you a quick reminder. Over the next couple of weeks, we're going to be doing some comms around the particular offers so that people get a really good understanding of what is on offer. So we've got the website, which is people.nhs.uk, and that has some information there already around pause spaces, leadership, teamwork, all COVID specific. What's coming up actually this week on the website is an interactive guide to the pause space. So that means that you can run the pause space on your laptop or on your phone, and somebody will talk you through that decompression space. So you don't need somebody doing that in your own team. We're including some specific advice and guidance around inclusivity. So we've really had some kind of thinking this week around how, when we're under pressure, we can go back into our bias thinking, how that can be amplified, because we're doing things really quickly. We're often doing things under stress and we don't really take time to understand. So we've got some really great materials coming up for that. Again, leading compassionately in a crisis. We're seeing a lot of language about gold command and command and control. And what we're trying to do is really think about, when is command and control appropriate, and how do you walk the journey of having to make really quick decisions and be reactive at the same time, trying to demonstrate some compassionate and inclusive behaviours at the same time. We've got a primary care coaching offer that's going to be launched this week. That's specifically for GPs and practice managers, recognising the kind of surge that's happening there. So the website, which also converts to an app, you can download that to an app on your phone, is the place to watch for all of the latest information. We've got the helpline that was launched proper last Thursday. So the helpline is open from 7 o'clock till 11 o'clock. The Samaritans are in the background helping us run that line. So their volunteers have stepped up and been amazing. We have had 350 calls up till yesterday. So great that people are calling in. Themes really are around just having somebody to offer emotional support, really worries and concerns about COVID itself, and anxieties about maybe some workplace issues. One of the specific themes, both from the helpline and the text line, I'll tell you about the text line in a second, is around relationship challenges. So again, not surprisingly, Easter weekend, long periods of holiday, schools are not in session, people being isolated away from families, and just how people are coping with that. So what we're trying to do is take the themes each week, really work with our local services, work with our HR directors to really think about So what could we offer nationally? So we've just started conversations with Relate about how we might offer some really key support around relationship difficulties, especially for those staff who are finding themselves kind of locked away in hotels, away from their families, really reaching out and making sure that they're supported well. And again, not to suggest that everybody's on the kind of verge of family breakdown, but just sometimes it's nice to have some dedicated support for some of these issues. A text line that Shout are running. Shout are a charity who are part of the Royal Foundation. By texting Frontline to that text number there on screen, you start a conversation with a human being. In the background, you've got clinical staff who are supporting those conversations. It's a fantastic service run by really willing volunteers who are also getting a lot out of doing this. They're really enjoying being able to help. Again, there's a real theme around worries and anxieties to do with COVID. So what we're doing is making sure that the materials on the website really do match that support offer. That's 24/7, that text line. So whether it's end of a shift, first thing in the morning, doesn't matter. You text and you'll get a reply from somebody. We've then got Silver Cloud. Silver Cloud are an amazing web-based mental health module. So whether it's sleep, you're having problems with resilience, stress or anxiety, especially COVID-related anxiety, they've got particular modules that you can work through yourself. The code is there on the screen. That one is also open to social care from next week, and there's a special code that social care services will have as well. I'll come on to the social care offer in just a second. But again, that's a really great resource if you want to just work through something on your own. And then again, we've got these fantastic mental health apps that are all free to NHS staff. So just to let you know, we had 15,000 visitors to the website last week and over 50,000 page views for the support offer. So we know that people are very much accessing the site, getting the information that they need, and had some great feedback on that. We've so far had 75,000, just under 75,000 downloads across those 4 free apps, and probably 700 conversations between the helpline and the text line. So again, if you think we're missing things here, that there are gaps in our service, really happy to hear from you. But hopefully what we can do through these sessions each week is really think together about what we're hearing, what we're seeing, and what you could be doing to respond to that locally, both within your teams and your organisations, as well as how we might help you regionally and nationally with some of these more broader solutions. Thanks, Zoe. Yeah, there's the doors. That's my lovely door image of, we see the Samaritans helpline, very much the front door. And then in the next couple of weeks, we're going to see the group offer come online. So again, these are great hosted spaces. People in those spaces will have had a background in group work, psychological understanding, and they will be in there to build a space of warmth and support, no more than 10 people in that group with you, where you just want somewhere to go and decompress, have some really good conversations. We'll be offering that space out in the next couple of weeks. The piece of work we're doing right now, which again we'll share with you in a couple of weeks' time, is around recovery. So what does recovery, if you think back to the framework of, we're in the active phase right now, in the eye of the storm. What does recovery look like? What do we need to be planning for? And how can we help with that? One of the conversations I've had this week with the Royal College of Psychiatrists was very much around, whatever we do, we cannot go back to just business as normal. We cannot just come out of this phase and expect staff to pick up and just carry on. We need to be planning for their recovery. And they gave me an example, which I thought was great, of the Army and the Navy, when they came back from the Gulf War. The Navy had 3 weeks on a ship together to travel back, whereas the RAF, they came straight back. and the longer term outcomes of those sailors was much better from having spent that downtime together, recovering together. So we can really start to use some of this evidence for our own thinking about how do we help teams recover so that organisationally we have much better outcomes in the long term. Thanks, Zoe.
Thank you very much there, Sonia. It's incredible to hear how much support is available out there. In particular, the statistics you've just shared with us, 74,000 downloads. That's just remarkable. So thank you very much for that. And we'll now go to the chat box, the chat room. There's so much activity going on in there. And I'm going to ask Helen to just share with us some of the themes coming through, followed by Rosanna. Helen.
Yeah. Oh, hi, Elizabeth, and hi, everybody. This is Helen Bevan. And what I'm doing today is I'm working with Ollie to keep an eye on what's happening in YouTube. So I'm watching the YouTube chat box. We've got over 100 people on live on YouTube, which is fantastic. We did the poll, even though we couldn't do the polls in the same way, and our answers were almost identical to the people on Zoom. We're just starting to create some questions, and I'll bring those back to you later. Just one quick question for Sonia. Sonia, are the resources available UK-wide? So will they be available to people to our colleagues in Scotland, Northern Ireland, Wales, and Southern Ireland?
So the website is available to everybody. We know that our friends in the nations have been working alongside us to make sure that there are offers that are delivered locally. So the offers around the Samaritans helpline are specific to the UK right now, but I know that Wales is coming on board tomorrow in terms of their offer, and that Scotland and Northern Ireland are again working on their own offers too.
Yeah. Brilliant. It's just a time for us to stick together, isn't it, as a UK? So that's great. Thank you so much, Sonia.
Rosanna, can you share with us what's coming up in the chat room?
Yeah, so in our chat room here today on the Zoom session, we have got lots of interest in the offer, and a particular interest in who the offer includes. For example, hospices, non-NHS staff, care homes, and how wide it can go. We've also got quite a lot of discussion about bereavement support as well. So there's been particular mention of distressed staff seeing distressed families and how we're able to support through the bereavement parts of the offer. And lastly, there's a bit of a discussion about face-to-face virtual versus virtual support. And this is a really important point that's come up from a variety of different perspectives in the chat. Some are worried about the virtual as a channel itself, but some are also very interested in it because it helps isolated staff in particular. We've also had a bit of a more recent discussion about line manager training. So lots of themes there, lots of discussion going on.
Okay. Thank you, Rosanna. Over to you, Zoe.
Thanks, Elizabeth and team. So on this first community session that we've got, we thought, well, through the themes that have been coming out, the telephone and the text line as well, there was a lot about stress. So we've asked Mike Holmes to have a conversation with us really about managing stress from a GP perspective. So welcome, Mike. Do you want to tell us a little bit about yourself?
Yeah, thank you, Zoe, and thank you for inviting me to be part of this. So as Sonia said earlier, I'm a member of the Health and Wellbeing Task Force, and specifically working on the primary care work stream. I'm vice chair at the RCGP with responsibility for membership, and I'm leading their wellbeing offer. But at the heart of it all, I'm a GP, and I'm a partner in practices up in York and Hull, and I'm in York today talking to you.
Thanks, Mike. So as a GP, when people come and see you, what are the signs and symptoms of stress?
So we certainly do see a lot of people with symptoms of stress, and the key point that I would make is that it varies. Everybody's different, and they often have a range of different symptoms. But the key thing is that we can group those symptoms into sort of psychological symptoms, which would be things like low mood or anxiety, irritability, maybe detachment, just seeming sort of slightly vague, poor sleep. And also we get physical symptoms. So headaches, nausea, palpitations, maybe sweating. So the thing is, it can be difficult to spot. But as GPs, we sort of look for them, and we see a lot of patients with it. And you can all look for these things, both in yourselves and in your colleagues.
So what sort of, so people come to you with these symptoms, what sort of strategies do you help people with, and is it different from what you provide for your patients as what us as either line managers or OD leads, HR leads, is there a difference of what we can do and what you can do as well?
So I think if you could pop the next slide on, Zoe, what we try and do is think about things in a number of different ways. So first of all, support and things you can do yourself, and then support you can get from those around you, and then perhaps support you get from external resources. And I think if we start with self, what can you do for yourself? One of the things is just have permission to put yourself first. And I think as carers, as healthcare professionals, as non-clinicians in healthcare, we tend to think about patients, particularly at times like this. But when dealing with stress, it's okay to put yourself first. It's okay to talk about it. And it's okay to talk about it in terms of supporting others. I think the other thing we do is look at the environment. So, are we safe? Have we got the right sort of PPE? Are we social distancing? If we're working from home, can we work from home? Have we got the right equipment? Are we working too many hours? I think as team leaders, as colleagues, we can keep an eye on that and make sure we don't overwork people and lead them towards burnout. And of course, it's looking after yourself, thinking about your diet, whether you exercise, you're connecting with friends and colleagues, taking regular breaks, and making healthy choices, i.e. not choosing to de-stress through things like alcohol or smoking or other drugs. That's really, really important. And then, of course, signposting to the app. We've talked about the website already. There's a number of free apps on there which might help people think about how they might look after themselves optimally. We also think about those around us. So those of us in teams, think about how you might blog within the team, write reports, write messages. I wrote a message to all our practice staff on a weekly basis, and they tell me that it's helpful. They feel supported by it. Can we put together videos to help colleagues and just get that message out that it's okay for people to ask, and it's okay for people to talk about this. In fact, it must be talked about. And then modeling behaviors as leaders, as line managers, as team members, we can model these behaviors. Ad hoc conversations with colleagues, positive psychology about the whole situation. And again, just being prepared to talk about embracing our own vulnerability and showing others that that's not a weakness, that's an absolute strength, particularly in situations like this. And then, of course, actually talking about it. We've heard about line managers getting involved, talking to staff. We've tried buddying our staff, so giving people someone that they can go to, that they've got permission to go to. And the other thing we're thinking about now are compassion circles or Schwartz rounds. And there's a team in Bristol and I think at UCL who've created a 20-minute, what they're calling a 20-minute test. And this is something that can be done virtually. We're sort of trialing it in our practice, in general practice, and it works really well. So, 5 or 6 colleagues on a call, a facilitated discussion around what matters to them at this moment. What are they doing to help the situation? What do they need? What are they worried about? And I think that seems to be working really well. And then externally, I guess look for support from your peer group, professional groups. At the Royal College, we've got our younger GPs, our newly qualified GPs, our late career GPs, all sending messages of support to the profession. And that's a relatively straightforward thing to do. And we can also look at virtual fora, WhatsApp groups. I'm certainly a member of a few WhatsApp groups that, we share learning, share questions, and that can really help to ease one's anxiety about what's going on around us. And then coaching. We've heard a little bit about what's coming down the line in terms of coaching. I'm working on the primary care offer at the moment, and I think that's going to be really, really valuable. So try and get plugged into the national offers that affect your work group, and encourage your staff to take advantage of that. And then, of course, sometimes further professional help is needed, and it's good to be aware of where colleagues can get that support. So whether that's occupational health, whether that's through the practitioner health program, or indeed through your own GP. You know, we're very aware as GPs that all healthcare workers in the NHS have a GP, and that we need to be there for them. And then, of course, specific therapy, you know, whether it's counselling, CPD, or other forms of psychological treatments, they're there for people if they need them. So I think that's it really, Zoe. It's that holistic perspective, you know, self, team, and external resources.
Thanks, Mike. That's really helpful to me as an individual, but I think it's also helpful for line managers and other people who are supporting our health and care staff at this time. I like how you've broken it down into these different areas where we can start to either, you know, really look at the individual, understand the individual, and put things in place for the individual. So that's really helpful. Thanks, Mike. One final question from me. What's your take-home message? If there's a couple of things that you'd like us really to take home and to think about after this seminar, what would you suggest we think about?
Well, I think in terms of stress for me, I think it's recognise it, acknowledge it, and talk about it.
Brilliant. Thank you so much. Well, there's loads and loads of comments in the chat box. Can we share this slide? I think it's out there already, isn't it? So thank you ever so much, Mike. Elizabeth, over to you.
Right. Thank you, Mike. Really interesting to hear those views. I'm now going to introduce Kim Nas. Kim is an Executive Director of Workforce and Organisational Development at West Midlands Ambulance Service University. And Kim will share with us their organisational approach on how to support well-being for their colleagues in their organisation. Over to you, Kim.
Thank you very much, Elizabeth. Yes, so thank you for the opportunity to talk to you about the work that we've been doing at West Midlands Ambulance Service. So if I could start by maybe backtracking a little bit about when we're thinking about stress management and supporting our staff. Historically, using the analogy of Little Britain, the computer says no. So managers felt very comfortable working to a policy. If they had a policy that told them how to manage a certain situation, then they felt very comfortable with that and didn't feel that, you know, that would derail them in any way. It also had this the belief that there was an assurance that treated everybody the same, and therefore managers could get on to manage, and they wouldn't have lots of people asking them to do something. If they put it in place for one person, they'll have a whole queue of people outside their door also wanting the same thing. So there's a real discussion around how to move that thinking, and so the process was to go to move that dial and turn no to yes. So if I could have the next slide, please. So this meant that we needed to have real visible leadership from the top, and a rationale of why we were doing it, why it was the right thing to do. I mean, morally, it's the right thing to do, but also organisationally, it provided a huge range of benefits. So managers were trained in health and wellbeing, and the information about health and wellbeing is very visible in board papers. So really, right away from the top of the organisation, you could see that this was an important aspect for us. during the discussions, there was a real disconnect often with knowing who your staff were. You knew how many people you had, but actually knowing who they were, what was going on in their lives, is so important. And this meant that really, you know, how many of us really know what's going on around us in clear view of everyone. So it's very easy to put a smile on your face and people to say, are you okay, and walk on, even before the answer is given. So really to get to more understanding about staff and what was going on in their individual lives. And then that enabled managers and others to start really listening to people and problem solving and designing the solutions together. So something went from being very generic to very individual, and that really started to change the dynamic. So I suppose the question really to everybody on the call today is, you know, do you really understand who is in your team? Do you know what is going on in their family? You know, what their children are going through, what their parents are going through, what relationships there are, what their aspirations are, and really get to know what those issues are for people. Because until you get to know people as individuals, you won't know what's the right thing to put forward, and you won't also notice some signs of changes in their behaviour. So if I can move to the next slide, which is so being in obviously in an ambulance service, our staff are dealing with quite traumatic things every day. And during our current situation, these are even more acute for us. So whether you're in the call centre and we have 111 services as well as 999 services, those new members of staff coming in at very short notice to be trained up very quickly to deal with the volume of calls means that we need to make sure that we're putting in a real wraparound service around those staff. And also we have our paramedics and our support technicians and a real army of student paramedics coming in to help with this surge in activity that we're all experiencing at the moment. So that means that we have to think about the different types of training that they all require. We do have a peer support service. We're training throughout on mental health first aid. That went in to managers first, but has also been escalated and cascaded out now to all areas. And we employ 2 dedicated psychotherapists and 2 physiotherapists, and they are only supporting our staff. They don't deal with NHS general patients, because we saw that there was a connection between physical issues and mental conditions and vice versa. So the 2 physical and mental conditions and that whole of that well-being is something that is very clearly interrelated. And so it's worth sort of thinking about whether somebody is going through a trauma of any description, whether it's a personal trauma or a physical trauma, and how that might then play out in the different conditions that they will experience. If I'm going to the next slide now, please. This one is really just to give you a snapshot. It only talks about the range of things that you can draw upon in an organisation. So, for example, we have we have health and wellbeing champions. These are volunteers that have come forward and said, how can I help? We have a organisation that is based in the communities across a very large geographical patch. And these health and wellbeing champions are absolutely critical to get those messages and that level of support and the understanding and being visual out in those areas. So having those people that step forward and said, I'd like to do this, I can be trained in signposting, I can be a good advocate for information that's coming forward. And they put, you know, small things on. They do free toast Fridays. They put fruit on during the week for their staff. They ensure that people have a ready supply of thank you cards, so that staff pass thank you cards to colleagues. Just small acts of kindness really are all coming through. But they're also a conduit when people need to know, where do I go for something? Where do I go to know, you know, how do I access a counselling service, or how can I talk to somebody? And they also run our quiet rooms, and the quiet rooms are great when you've got a really demanding job and you just need to go somewhere and just reflect for a minute on your own without having to explain yourself as well. Can I go into the next slide, please? In addition to the internal resources that we all pull upon, we're surrounded by a range of external support. And as been mentioned earlier today, on the national offer, those national offers are really a great repository for services and information and toolkits that have already been validated. So it's a great place to go into and pick out what you need, and they're tried and tested resources. If I can just move to the next slide, which is just providing a snapshot across my organisation. This is the sorts of things we put on the website for our staff, and they can click into those boxes, and behind each of those there will be a range of resources. So while people are isolating, this is a great resource. But in addition, we've been trying to booster some of these with things like video clips. Our physiotherapists have done a series of short clips, they're only a minute or so long, and they just give people some options when they are struggling at home with various either physical or motivational pieces. And so it just gives you a snapshot. You'll all have these sorts of things going on, I'm sure, but what it does for staff is to say we've got a real wraparound service for you, and that everybody's involved in this. It's actually, you know, everybody's business to stay connected. So final couple of sentences really is that everyone can make a difference to colleagues. It's really important that you don't think it's somebody else's role. Everybody takes that. But those of you that are fortunate enough to be in a managerial or position of authority, it's, you know, you're in a unique position to use what you've got to make your organisation a place where people can flourish. And I just want to end on a statement which I do reference, is cribbed from Dolly Parton. Dolly Parton had this, it takes a lot of money to make me look this cheap, words to that effect. And I've just adapted it a little to say it takes a lot of effort to make it look this easy. And I'm sure you're all in that position, you know, all of this health and well-being, looking after colleagues, really taking care of people, yourself, your teams and everybody else. It truly does take a lot of effort to make it look this easy. So well done. And you know, I think this sort of community group is absolutely the perfect place to really share what we can all do together. So thank you.
Thank you very much, Kim, for sharing some of those very practical initiatives we can put in place to support our colleagues. I think one thing that stood out for me is, you know, do we all really make time to understand people in our team? because it's only in doing that that we notice the changes and also tailor our offer to them. Thank you very much, Kim. Meanwhile, there's lots of activities in the chat room. I'm going to go over to Cheryl now to share some of those themes and reflections that are coming through the chat room. Cheryl.
Thank you, Liz. Essentially, I think there's lots of chat in the chat room. I think there's also people expressing lots of thoughts around the difficulties in actually getting to know large teams. And recognising when there are specific issues or changes that are occurring with those individuals. So getting to know staff can be a personally challenging thing to do when you have a lot of staff that are working under you. So I guess it's looking at ways in which we can get to know our staff and probably looking at those distributed leadership type models that allow people to get to know one another.
All right. Thank you, Cheryl. I'm now going to hand over to Zoe.
Thank you, everybody. So we're now going to come to some interactivity. So if you're on Zoom with us, we're now going to move into some virtual breakout rooms for you to have a conversation with 5 or 6 other people. If you're in YouTube, we'll come to you in a moment. So hold fire. So when you go into your breakout rooms, a little box will appear like this one in the bottom corner, which will ask you to join a breakout room. If you just click on that, you'll be sort of transported into a new little room with some other people. What I'd love you to do when you get to your groups is just introduce yourself, say hello, some quick hellos, and agree who will capture maybe a couple of bullet points from your conversation to share back in the chat room with everybody else when you come back after 10 minutes. And this is the question we thought you might, well, we'd love to hear about really, or, you know, what are the signs of being overwhelmed that we're currently looking for in other people, the people that we work with? And also, what are your top tips for supporting others to help themselves and also to go on and help more people as well? I'd love to hear more about those top tips so that we can capture those. So what I'm going to ask is our tech colleagues to start the breakout rooms. What you might want to do before you go is just take a little screenshot of the question on your cameras, or just make a little note of the question. So what are the signs of being overwhelmed, and what are your top tips of helping people to help others through stressful times? And then we'll transport you for 10 minutes. Now, I know some people would be saying, oh, yes, I can get to talk to some other people. And other people might be like, oh, maybe this isn't my comfort zone. You know, just engage in a way that's comfortable for you. So you can talk, you can use the mute and unmute button at the bottom of your screen to talk, or you can use the chat box. Just do what's best for you. You might want to capture each other's contact details as well. So if you're on a Zoom with us, you'll now be transported to another room with a few other people to have a conversation together for 10 minutes. So it should be arriving now on your screen. All you need to do is click join.
Lots of people are disappearing, Zoe, from the chat box. So it's from the participant list. So it's definitely working.
Excellent. And if you're on YouTube, stay with us. We've got some things, some interactivity with you as well. So if you can just join your rooms, and Helen, over to you.
Yeah, thank you, Zoe. So hello to everybody who is on YouTube. So everybody that's on Zoom has gone into little breakout rooms to have conversations. But we, the people of YouTube, we have to do it through the chat box because there's no facility to break out. So what we're going to do, I'm going to be joined by my colleague Ollie. So Ollie, would you like to say hello as well?
Hello.
Hello. So Ollie and I are going to keep an eye out, and what we're going to do is we're going to use the chat box, and we're going to focus on exactly the same questions. So this being fantastic for the next 10 minutes depends on us engaging with this in the in the chat box. So the two questions that we've got, as you can see here, what are the signs of being overwhelmed that we're looking for in other people? You know, when we want to support others and their well-being. And then the other one is, what are our top tips for supporting others to help themselves and help others? So Ollie, can you have the job from us to put the comments into Zoom? Is that okay? Eventually.
Yeah,
definitely. When we get back. Yeah, brilliant. So there are 83 of us watching now. So what I hope is that we can actually put some content, so we can put some comments in the chat box. So our first questions is, you know, when we're all here to support other people. So what are the signs that we would maybe see in other people that tell us that actually people are overwhelmed? Okay. So Caroline's given us our first one, which is fantastic. Look deeper than an answer like "I'm okay." Ask gentle questions and listen to the answers to really hear what people are saying. And I think that fits in with what Kim was just saying. You know, take the time to really understand what's happening. Anybody else like to add some things? There's quite a lot of people that are still in the main room on Zoom, and if any of our colleagues want to join in as well, you could actually take your some of you we could actually, if you're a host, you can take your mute off as well and help with this. So so what we'll maybe do is we'll work between both chat boxes. Tell you what, Ollie, you keep an eye on the YouTube chat box, and I'll keep an eye on the Zoom chat box, and we'll manage it between us.
That sounds a good plan.
Yeah.
I think people have been having to warm up their keyboards because they're going great guns now on the chat on YouTube. We've got Sam Eccleston saying poor memory, negative when normally positive, asking the same questions as some of the signs that people are overwhelmed. Kate says changes in behaviour, irritability or withdrawing. Teresa says signs of being overwhelmed include disturbed sleep, getting irritable and not being able to concentrate. Jackie says not listening, not focused. And Charlie says rushing around, doing the work of 3 people, heroic stuff, which isn't sustainable.
Yeah.
And yeah, lots more comments.
It's interesting, you know, heroic stuff, because you know so much of the media at the moment is talking about NHS heroes, and you know, when we think about heroic leadership, you know what that means. We've got a comment here from Karen on Zoom, and Karen saying watch out for uncharacteristic withdrawal or attention worry to details. I think that's a really really good answer. And again, anybody that's still on Zoom, you know, please put some comments in.
Yep, lots more comments coming through on YouTube. We've got Louise, a small shift in behaviour that isn't usual for those people. And she says you're reflecting on what Kim said about knowing your people so that you recognise those signs. Some coping, Linda suggests things like looking for coping mechanisms like more drinking, unhealthy coping mechanisms like more drinking. And Marie says, you know, one way of sort of engaging with people is to ask about what they did at the weekend, what you're doing this evening, and often you'll hear things that give you more of an idea of how somebody is by their reply.
Great, these are great, and what we want to do as well is we're going to take these and we're going to pull them all together, so that's really helpful. Should we move on to the second question? So, you know, when you think about the people that are here, either on Zoom or the people that are on YouTube now, there's some pretty experienced, pragmatic people. So, can we do like a little list, or could everybody have a go at putting in your top tip? What's your top tip for supporting other people, and first of all to help themselves and to help other people? Okay, so we'd love to see your responses to that. Okay, what have you learned as a leader or a coach or a support person around how to support other people to help themselves and help others?
Just waiting while people are thinking about that. A few more comments for question 1 saying, so people staying longer after work when team members could stay. People being, Janice says, people being exhausted, working over and above, and losing sight of their priorities. And then on the top tips for supporting others, Fiona suggests taking time to chat in a calm and quiet location. Janice says, listen and don't judge. And Jackie suggests making space to actively listen.
Yeah. Great. So let's move them on now. Let's move our comments on now to some of the top tips. Again, what's your top tip for supporting other people to help themselves and to help others? So let me have a look who I've got on my participant list. I might get somebody to say something as well. Yeah, we're getting a few here now. Karen, you're putting some really good stuff on here. So Karen is saying, be kind to yourself. Notice and acknowledge your vulnerabilities. This helps being kind with others. Nobody is infallible. That's the right word. Are you getting any there?
Yeah, lots of people now saying.
Yeah.
Teresa says the more you talk, the less power it has over you. Lots of suggestions about active listening from Esme. Catherine White says leaders showing their vulnerabilities and that they're also effective gives others permission to reflect on their own feelings. I think that's so true. Sort of making people recognise that they're not alone. And Jackie says when working remotely, make space for general conversations, not just work.
Yeah, these are great. So Louise actually is with us at the moment. Louise Pratt, can you hear me, Louise? I mean, you're somebody that I look to and admire so much around the work that you do around wellbeing. What would your top tip be?
I think the point making around access and what them of and that was when you're taking.
Yeah, it's quite hard to hear you, Louise. It's not. I think we're not getting very good reception. Try once more.
So I was talking to Louise earlier today, and the reception isn't too good at the moment. So
I know. Don't worry.
I think the breakout rooms are closing now, are they, Paul? And everybody's coming back.
Okay.
Time flies
yes, the
when you're having
breakout
fun.
rooms are back with us now.
Yeah. Oh, great. Anyway, thank you everybody on YouTube, and thank you everybody that stayed on on Zoom, and there were some great tips there. So Zoe, back to you, and Elizabeth.
Thanks, Helen. So I'll come back to you, Helen, just for a quick update on what was discussed, and then I'm going to come to Rosanna.
Yeah. We worked with the people that were on YouTube and the people that stayed in the main room on Zoom, and we worked through the chat boxes, and I think there were some really really good conversations, and I think that to me the key things were, first of all, about being kind to ourselves. I think the second thing was around making time and understanding that that well-being is important. And then I think the third thing ties in absolutely with what Kim was saying around being kind, being compassionate leaders, looking out for people, listening, understanding where people are coming from. I think those are some of the core things. But you know, some great ideas and wisdom in our two chat boxes.
So I was in breakout room number 19, and we had a great chat about some of the signs of being overwhelmed. Some of the things that came up were actually withdrawal and silence is a sign of being overwhelmed, lack of focus on self-care and loss of focus. And we had quite a lot of chat about that. And actually most people in my breakout room had coaching experience. So there was a common desire to provide space to talk. And that is a really important top tip, particularly space to talk where there is non-judgment, which is a kind of key thing that you learn as a coach. So having that kind of skill to provide space to talk with non-judgment was a top tip from our room.
Fantastic. Thanks ever so much, Rosanna. And there's so much more coming in the chat room as well. So please do add the things that you were talking about into the chat room as we finish our session today. So just one quick reminder, please do learn, share, and have a good look at all the resources that are on the website, people.nhs.uk, where you'll find links to lots and lots of documents, guides, help, support, both yourself and your staff. So please do have a look at all of that and share widely. A plug for Rosanna. She is helping to devise some evaluation around this. So if you'd like to be involved, we'd love to capture your stories and experiences. So please do email Rosanna, and there's a link on our website as well. And I'll ask Rosanna to put her details in the chat box. And Ollie, if you could put it in the YouTube chat box as well, that would be fantastic. We've got one last poll. So if we could put this poll up, that would be fantastic. So to what extent has today's session been useful in your own role in supporting staff in their health and well-being during COVID-19? Not helpful, all the way up to number 5, which is helpful. So again, if you can't access the poll, then please do add to both chat boxes. And this will come to an end quite shortly, and we've got a blend. And then please do also add your comments in the chat box about why you answered in the way that you did. Did you like the breakouts? Was it not quite for you? Would you like more work, more time in the chat box, or would you like more time interacting in small groups? Please do let us know. The majority are saying number 4 at the moment, and we'll just pause that polling there. So thank you ever so much for everyone who has shared your views and thoughts. So please do keep those coming in the chat box. So I think we'll probably end by saying, you know, if you want to find out more about what's going on, please do join a mailing list that we've got coming, which is via this website, and we'll put the link in the website as well, and in the chat box. We have our next session, which is a conversation with, so back to our formal session, which is all about talking with our experts. And Sonia, would you like to say a final word about this before we close?
So as part of the recovery phase, we've got a 4-stage model that we want to trial and test with you. One of the things that we've picked up this week is about not being overwhelmed yourself. So think mirror and reflecting back to others, not sponge. So one of the things that we want to look at next week is how do we as well-being leads ensure that we don't become overwhelmed and that we're able to focus ourselves on the recovery stage and the planning that we'll need to be doing that.
Fantastic. Thank you ever so much, Sonia. So next week, 22nd of April, 4 till 5, and all the details will be on Twitter, on social media, and on this webpage as well. So please do keep adding to the chat box. If you like this session, what was it? If you'd like more from these sessions, what would you like? And we will keep refining these sessions so that you're getting what you need when you need it. So thank you so much for joining us. and we look forward to speaking soon. Take care.